Unfortunately, knee replacements are not quite as well tolerated. They tend to be more difficult for patients, and I think that has to do with the complexity of the joint. So basically, you're resurfacing an arthritic knee joint with metal and plastic pieces, as would be depicted by this slide. Sometimes the term total knee replacement can give patients the wrong idea. Sometimes they think you're going to cut out their whole knee, but actually you're not. You're going to resurface it with those pieces so they don't have bone rubbing against bone anymore. There have been some advances. There's what's called patient-specific knee replacement, where the patient will get an MRI beforehand, and these cutting guides that are depicted in the cartoon are made for their unique anatomy to help us during the surgery. And that allows the surgery to be done through a smaller incision with less trauma and hopefully then less pain and a quicker recovery. And also the minimally invasive technique depicted here that avoids cutting into the tendon above the kneecap. That's also something that can speed up the recovery. And this is, at this point, something I do on just about every single knee replacement. Partial knee replacements are knee replacements that only resurface one element of the knee. There are basically three different parts of the knee that we talk about: the inner part and the outer, and then under the kneecap. And this has been increasing in popularity. There's less surgery involved, and the patients after these surgeries, when it's appropriate, will tell you that their knee feels more like a normal knee than a total knee replacement knee, because you haven't removed any ligaments where you would have to remove ligaments in a total knee replacement. These are those three parts of the knee, and these are some x-rays depicting how any of those parts can be resurfaced individually.